Are biased, the Idaho Press Club are biased, all media, newspaper, radio.
To be completely blunt here, Brian, and there are plans to expand
indoctrination.
That's right.
Well, Idahoans are also concerned.
Horror shot. That line would be moving a little bit farther west.
I'm like crying.
Nobody wants to see
dark money is influencing policy in our state.
Well, that's not how this works.
Well, hello there and welcome to Nowhere to Hide. We're going to be talking a little bit about how the media is ramping up a fear campaign. I'm trying to figure out for the life of me why it's time to turn the fear back on, but we'll examine some of the ways that that's happening. We're also going to spend a little bit of time talking about should your elected officials be able to block you on social media. But now, before we get there, let's throw an invite out there for those of you who are following the Idaho Freedom Foundation in the Twin Falls or Magic Valley area. A special announcement from Angela, who is one of my compadres.
Whose bed have your boots been under? Whose heart did you steal, I wonder? This time... Hi! Hey, what are you doing this Thursday, July 14th? Because I would love if you would join us for karaoke and drinks at the Log Tavern in Twin Falls, Idaho from 9 to 11 p.m. This event is sponsored by IFF and IFA. Let freedom sing.
Indeed. Let freedom sing. I'm looking forward to it tomorrow night and hope that you'll have an opportunity to join us. So I don't know if you have noticed this, but the fear is being dialed up again regarding COVID. And it's not just here in Idaho, although I'm going to share an example from the Idaho Capital Sun. In fact, I want you to check out this headline as well as the graphic that accompanies it. Look at this headline. Idaho nears a milestone of enduring tragedy, 5,000 dead of COVID. Pandemic has cut short the lives of many more Idahoans through excess deaths. And you can't see it very easily there, but each one of those little dots represents a single person. 4,993 lives lost as of Monday of this week. And it was expected that likely this week we would see 5,000 people dying because of COVID. Now, this is not to in any way downplay the loss that those family members feel. In fact, I think most of us probably know someone who has passed away from COVID or suffered long-term consequences from it. And this is in no way to diminish those deaths. But I'm going to give you some examples in this story from the Idaho Capital Sun, which raise some very interesting questions because of the way that it's being reported and because why it's being brought to the forefront right now. The World Health Organization has said, now hold on, don't act like this pandemic is over, as if they're thinking about bringing back, some of the worst aspects of how the pandemic was dealt with over the last 2.5 years. So let's dive into the article, and then we'll talk about some of the bigger picture stuff. But the Idaho Capital Sun says Idaho will soon lose its 5,000th life to COVID-19. The state's coronavirus-related death toll reached 4,993 on Monday. 2 of the dead were under age 18. Another 272 were adults who died before their 50th birthday. As the wave of hospitalizations due to the Delta variant slammed Idaho's hospitals in fall of 2021, Dr. Jim Souza of St. Luke's Health System said the system's hospitals had lost 80 patients to COVID-19 in the first 3 weeks of September. More than half of those patients were in their 50s or younger. Now, again, when you're talking 5,000 deaths, I mean, we're looking at what? Roughly 274 here that were under the age of 50. Tragedies, absolutely. But let's not forget that primarily this is a disease that was affecting the very elderly and those with compromised immune systems or who had what were called comorbidities. Now, the article goes on to talk about the really morbid exercise of considering what those numbers mean. I don't know why it's considered a really morbid exercise, but Dr. Souza says we've lost more than 1,100 life years due to those premature deaths, he said. Can you imagine? For people who say we all die sometime, yes, we do. But these people didn't need to die now, and they didn't need to die like this. Can you imagine all of the life and experiences contained within those 1,000 plus years? We shouldn't trivialize that rather. These people deserve better. Now, I'm curious what exactly he means by these people didn't need to die now and they didn't need to die like this. Because this is not the kind of virus that kills everybody who gets it. Not even close. In fact, we'll throw some statistics out here that should help put this into perspective and hopefully walk us back from that cliff's edge of panic that it sounds like, man, it sounds like everybody's going to die. And, this totally could have been prevented. I think he may be well-intended here, but I don't think that to say that these were deaths that were premature and should have been prevented, I think that is something that's really not up to him to say. Just like you just don't know. Perhaps, with early detection, somebody might have got treatment that would have helped them out, but we just don't know this. So it seems a little bit premature to pretend that somehow, if everybody would have just done what? It would have prevented the likelihood of these deaths. I'd like to know a little bit more about what Dr. Seuss is talking about. Now, the article goes on to talk about excess deaths from COVID and other causes. And I actually kind of like that they approach, the other causes here too. The lives lost are just the official tally of coronavirus-related deaths. The pandemic took more lives than that directly and indirectly. Federal data on excess deaths show that since February of 2020, about 1,300 more Idahoans have died than would be expected for Idaho, on top of the thousands of excess deaths known to have been caused by COVID-19. Okay, fair enough. There were probably some other causes. Now, they go into some of these. Additionally, some of those deaths may have been COVID-19 related, but were attributed to comorbidities like heart disease or Alzheimer's disease. Some of them may have been related to crisis and strain in Idaho's hospitals. For months, patients had to spend hours or days in the emergency room. Doctors had to send critically ill patients by airplane or helicopter to other states. And Idaho's overloaded healthcare systems had to suspend procedures as major as heart surgery or tumor removal. Now, I want to point out, it's true. Hospitals did suspend a lot of those procedures. In fact, they treated them as elective procedures. But that was not the choice of patients. That was not the choice of anybody except health officials saying, well, we got to make sure that we're not going to be overloaded. And I don't know to what extent those emergency rooms were, or ICU units were tasked with or oversaturated with patients. But it's true. There were a lot of people who missed out on life-threatening conditions, be it heart-related or cancer-related or even mental health-related, that went untreated because we were trying to keep, the emergency rooms and keep the hospitals and doctors' offices free of everybody except COVID patients. Now, the article goes on to talk about how the coronavirus disease has killed 88 Idahoans under age 40 and another 186 who are in their 40s since the spring of 2020. Listen to this next line, though. The deaths left families and friends without their loved ones, left children to mourn their parents, and left healthcare workers traumatized. Again, I'm not trying to minimize anybody's pain and suffering here, but this is pretty obvious. Yes, someone you love, a friend or family member dies. Of course you're going to miss them. Of course you're going to mourn them. As far as the healthcare workers being traumatized, I'm still trying to figure that one out because I think, as far as I know, nobody is drafted into the healthcare profession. It's not like it's a military draft and you have no choice but to join. It's what people choose to be a part of. They understand that part of being in healthcare means you're going to have to deal with some pretty difficult situations, including disease, death, and dying. So I'm not really sure of why this is being reported like this. It's very long on emotional-laden words, which always makes me just a little bit suspicious because I get the impression that the author of this story is trying to play upon my emotions and otherwise generate some kind of feeling as opposed to just simply presenting judgment-free facts and then letting me draw my own conclusions. To put it a little less delicately, I feel as though someone's trying to clip a ring through my nose and then gently lead me to a conclusion that they would like me to come to. I don't appreciate that, and I hope you don't appreciate that either. We're very capable of thinking these things through and arriving at the facts on our own. We don't need to be led and especially be herded along with the help of an emotional prod. Look at this quote, though. This one really jumped out at me. Once at the height of Idaho's Delta wave, deaths were so frequent that workers in one morgue had no choice but to stack bodies on their sides, like books on a bookshelf, according to a person who worked on the front lines at the time but was not authorized to speak for their employer. In other words, please trust us. This anonymous source is telling you about this horror story of morgues so full that we had to stack people in there like books in a library. And, for all I know, it could be true. But again, I come back to the question, why are you reporting it this way now? And what is the purpose of dredging up these painful memories and trying to portray this horrific imagery? Oh my goodness, bodies stacked so deep that there wasn't even room for them in the morgue. What's the reasoning behind this? Now, I could be wrong. I'm totally prepared to be wrong. But it sure feels like someone is trying to fan a little spark of fear and maybe get it to grow into a flame. And I have to wonder what purpose that would serve. Now, this is something that media throughout the pandemic has been doing on a very regular basis. Look at this screen grab from CNN and tell me if you remember this. Remember the blood red countdown up in the corner there, coronavirus pandemic? Every bit of their programming was heralded with this blood red announcement about the coronavirus pandemic. It was always there, an ever-present reminder, 24/7 around the clock. And there's the countdown globally. How many cases? How many deaths? Oh, look, here's the United States. How many cases? How many deaths? Kind of an interesting little note there on the chyron below Dr. Fauci. This won't be an overnight event where you get a vaccine and it's okay. As hard as he was pushing the vaccines, I would have thought maybe he would have suggested something like that. So the bottom line is there was a lot of fear-mongering going on. There was a lot of pushing our buttons and constantly keeping us in a state of uncertainty and fear about what is this epidemic going to do. And look, I'll admit, like a lot of people, when it first came out, I had no idea. It was a scary time. It was very uncomfortable. We didn't know exactly what we were dealing with. But as time went on, people started to realize, okay, the risks are there. And people who came down with COVID definitely had something to deal with. And for some of them, it was a very serious thing. But we still were lacking perspective as to how dangerous was this virus really. So I was interested in getting a second opinion. Well, here's that second opinion.
It clearly is a very serious epidemic. But equally, the fact that actually the great majority of people will not die from this. And I'll just repeat something I said right at the beginning, because I think it's worth reinforcing. Most people, a significant proportion of people will not get this virus at all, at any point in the epidemic, which is going to go on for a long period of time. Of those who do, some of them will get the virus without even knowing it. They will have the virus with no symptoms at all, asymptomatic carriage, and we know that happens. Of those who get symptoms, the great majority, probably 80%, will have a mild or moderate disease. Might be bad enough for them to have to go to bed for a few days, not bad enough for them to have to go to the doctor. An unfortunate minority will have to go as far as hospital, but the majority of those will just need oxygen and will then leave hospital. And then a minority of those will end up having to go to severe and critical care, and some of those, sadly, will die. But that's a minority. It's 1% or possibly even less than 1% overall. And even in the highest risk group, this is significantly less than 20%, i.e. the great majority of people, even the very highest groups, if they catch this virus, will not die. And I've really wanted to make that point really clearly.
Okay. I mean, look, I don't think this gentleman would count as any kind of a COVID denier or vaccine denier or whatever other pejorative people might be willing to throw out there, because he's not touting the line that the media and experts, government experts and bureaucrats were touting. But there was definitely some perspective there. And that perspective, if people understood it, would certainly make them a little more reluctant to just jump and do whatever someone in authority was telling them to do without saying, now, wait a minute, why exactly do you want me to do it? Why do you want me to wear this mask? Why do you want me to get the vaccine? Why do you want me to close my business? So I'm going to hit you with a few quick facts, courtesy of Kit Knightley from offguardian.org. And Kit Knightley put together what's called a crib sheet, 30 facts you need to know about COVID. And I'm not telling you you have to believe this. I'm just going to tell you that these are facts that are very easily checked out. You can see for yourself and verify them. They actually come from the Swiss Policy Research Organization, and this is some pretty heavy duty. This is not just people sitting around pulling facts out of thin air and opinions. Well, this is what I think. These are actual studies, but these are some of the things that they found, and I think they're very worth your consideration, especially as people are trying to ramp up the fear again. Kit Knightley points out almost all studies on the infection fatality ratio, or IFR, of COVID have returned results between 0.04% and 0.5%, meaning COVID survival rate is at least 99.5%. Now, that can differ a little bit depending on what age group you find yourself in. Obviously, as you go upwards in age, when you get above 70 years of age, the survival rate drops to something like 98 or something percent. But still, you're talking for the vast majority of people. If you're under 70 years of age, you've got a 99 point something percent chance of surviving if you catch the virus. So it's a serious virus for some, but hardly worth the panic that some seem to be promoting. So here are a few takeaways from the Swiss Policy Research Center that I think are worth sharing. And again, you don't have to believe them. I'm just asking you to please consider them. COVID death counts are artificially inflated. COVID countries around the globe have been defining a COVID death as a death by any cause within 28 or 30 or 60 days of a positive test. Now, look, I know of instances, I think it was in Florida, where a guy who died in a motorcycle wreck, in the autopsy, they tested him, they tested his blood. Guess what? The PCR test showed, hey, this guy has the coronavirus in his system. His death was counted as a COVID death. Now, that begs the question, why would officials want to count any death as a COVID death? Unless they were trying to inflate the numbers, unless they were trying to exaggerate the seriousness and promote the fear to keep people in line and keep them on the narrative. And conversely, if someone died within a certain period of time after getting the vaccination, as long as it was within a couple of weeks, they were counted as unvaccinated if they died of COVID. And, I don't know. That sounds like some cooking of the numbers, and I'm not sure exactly why, but it does make me question, why would the counts have been artificially inflated, if not to promote fear and uncertainty among the populace? Also, the vast majority of COVID deaths have serious comorbidities. As far back as March of 2020, the Italian government published statistics showing 99.2% of their COVID deaths had at least one serious comorbidity. If you remember, Italy was hit extremely hard at the beginning of this pandemic. Here's another one that I think this is one of those unpopular truths we're not supposed to mention. We shouldn't be talking about it, but I'm going to say it because it deserves to be said. Lockdowns do not prevent the spread of the disease. There's little to no evidence that lockdowns have any impact on limiting COVID deaths. If you compare regions that locked down to regions that did not, you can see no pattern at all. It's almost as if the virus followed a very predictable path, as viruses have done, as long as we've been aware of them. Over, generations that we've been aware of viruses. Pandemics have played out pretty much the same way. The virus moves through the society, regardless of what politicians say or what words they put on paper. And when the virus is spread far enough through a society, enough people have obtained natural immunity, at that point, the virus becomes endemic. And as we have seen with COVID, it becomes less and less potent, less and less threatening as more and more people have had it. This is where herd immunity plays a role. But again, we weren't really allowed to consider this. And if you look at nations like Sweden that did not lock down and did not force everybody to wear masks and didn't, pull the plug on their economy versus those countries that did, there's really no difference, no noticeable difference in those countries that locked down that you could point to and say, oh, yeah, well, look how much better they did and how much easier the virus went on their society, because it didn't. It did what viruses do. And that's the lesson we need to take away from this. Also, PCR tests have a history of being inaccurate and unreliable. Now remember, this is the gold standard. PCR tests for COVID are known to produce a lot of false positive results because they react to DNA material that's not specific to SARS-CoV-2. And so false positive tests often were reported as, oh, that's a case. And I know a lot of people, even myself, tend to conflate, oh, there's a case. Well, that must mean somebody's really sick. No, that just means somebody's test came back positive. Now, that doesn't mean that they were necessarily hospitalized. It doesn't mean that they were sick or they died, but that's kind of the impression that we were left with. Well, if it's a case, it must be very serious. Maybe not. Masks don't work. I know this is a sore spot for a lot of people, but I'm going to go ahead and put it out there. At least a dozen scientific studies have shown that masks do nothing to stop the spread of respiratory viruses. In fact, one meta-analysis published by the CDC in May of 2020 found no significant reduction in influenza transmission with the use of face masks. Now, vaccines do not confer immunity or prevent transmission. Again, this is a hot-button issue. But if you want to do the research and look into this yourself, you'll find that there is plenty of evidence to support this. It is readily admitted that COVID vaccines do not confer immunity from infection and do not prevent you from passing the disease on to others. Indeed, an article in the British Medical Journal highlighted that the vaccine studies were not designed to even try and assess if the vaccines limited transmission. Probably the best proof I can think of to drive this home is that multi-vaccinated, multi-boosted Dr. Anthony Fauci himself was diagnosed with COVID recently and was treated with, I forget the name of the drug, but even with that treatment and even with all of his vaccinations and with all of his boosters, he still had a resurgence of the virus. And I'm not wishing ill on the guy. I'm just pointing out, if something doesn't work to prevent you from getting the disease, if it doesn't work to prevent the transmission of the disease, I'm not sure that do it even more is the answer that, which unfortunately is what many of our health officials and their enablers within the media have been promoting. So it leaves us with some questions that deserve to be answered. And I understand these are hard questions. Still, I wonder why the press doesn't approach this. First thing I want to know is, why has the news media taken such an uncritical stance of those in authority? Why have they not questioned these things? Why have they just gone along with and tried to reinforce whatever the doctor says, whatever the science says, it's settled? I don't think that they have served the public in the sense that they've given them the facts and let them decide for themselves. Instead, they have very much been trying, the media, have tried to serve those in power and to manage the narrative for them. And in fact, there are entire legions of fact checkers and algorithms that have worked very hard to make sure that alternative viewpoints and competing viewpoints are kept out of the public eye. That should make us a little bit suspicious. And again, news media, why would you not give us the facts and let us make up our own minds, including, hearing dissenting voices? You can say, well, because it's just too dangerous of a topic, we can't take that chance. Well, what are you trying to do then? Are you trying to think for us? Are you trying to manage thought for us? Can we not be trusted? Are we little children who need to be spoon-fed something? Because that's pretty insulting. Second question, is the pandemic being used to keep the populace fearful and willing to obey? I know that it worked the first time around. A lot of people were very fearful and afraid and not sure what to do. And so when they were told, you will close down your business, you will stop meeting for church, you will not stand closer than 6 feet to anybody, you will follow the directional arrows in the grocery store aisles, they did it. You will wear a mask if you want to go anywhere, if you want to fly here, if you want to come into this store. Now, if those same kinds of lockdown procedures or if those same kinds of policies are about to be re-implemented, I don't know a nice way to say this, but bro, I'm not going to play that game again. And I know there are a lot of people who feel the same way. It didn't stop or slow the virus. It didn't flatten the curve. And I'm not about to give up another inch of my freedom. So don't even try to bring it back. And this is the last question. And again, this is directed primarily to those within the media who've taken the position of advocacy for the medical establishment. How can we, meaning we, the people, the citizenry, how can we accurately assess risk without accurate information? And again, not to denigrate Dr. Souza, but those who say, well, we're all going to die at some point. It's true. We are all going to die at some point. There is nothing you can do in life that is without risk. But the question is, who gets to make those decisions about what risk you are willing to incur? And the fact is, it should be you and I making those decisions for ourselves. Now, if a person has a compromised immune system, if they feel like, well, I don't want to be at risk, I don't want to get out there where there might be sick people that I could catch something from, it is totally within their purview to make the decision that, you know what, I'm not going to go out in public. Or if I do go out in public, maybe I will wear a mask and maybe I'll take, precautions to protect myself. I'll shop at times when there aren't peak customers. I'll try to keep my distance. And I'm not looking down on anybody who does that. But I have no stomach for people who would try to force everybody else to toe the line that they wish for us to toe. That's just petty totalitarianism, using a virus to justify its imposing itself on other people. And it's wrong. So whatever reason the fear is being whipped up, be suspicious. And to the news media, I would encourage you, stop advocating for the people in power and ask the questions. You can still, if you really believe that, but they make the better case, then make the case. Don't pretend that it's the only viewpoint that can be considered and that everybody else should just shut up and fall in line. That's presumptuous. And it's kind of anti-human at its heart. Don't do that. All right, shifting gears. Just want to touch on this one quickly. Can elected officials block Idahoans on social media platforms? In recent years, the ACLU of Idaho says they fielded dozens and dozens of questions about elected officials blocking Idahoans online. Now, I don't have a great deal of sympathy for most elected officials, but I'm going to tell you, I can see a point where elected officials may not want to be just subjected to abuse. It's not like social media is a pillory that you go put yourself in and let people throw rotten fruit and vegetables at you at their whim. As technology evolves, the story from KTVB says, so does the law. And in recent years, a big question in Idaho, can elected officials block you from a social media page, or is it a violation of free speech laws? Adhika Singh, legal director for the ACLU Idaho, says, we've gotten dozens of complaints, really from community members over the last few years. I'd say they really picked up. I think in 2020, it was a very dynamic legislative session, let's say then, and in 2021 as well, and it led to a lot of people being blocked. Now, the ACLU team researched the blocking question and its interaction with things like the First Amendment as they continue to get inquiries about it from Idahoans. Singh said, we found that folks might have had real legitimate claims under the First Amendment. We were really hammered with dozens, maybe close to a couple hundred complaints over the last couple of years. Really, our belief is that it shouldn't take a lawsuit for public officials to follow the law. Now, look at this flow chart that they put together. And I have to admit, I think this is actually a pretty reasonable flow chart because it asks, questions about, okay, so was the website or the social media site, did it have the words, I think the words elect or vote for? In other words, is it a campaign social media page? If the answer is yes, then you don't have a basis for a complaint. Now, if it's something that they use that has a government office contact info like phone number or email address, or they use the page to promote policy and discuss issues, that could change the situation. They also ask, did you look at the posted comment policy? And if you look at it, what does it say? Did you violate their terms of use, or did you violate the comment policy? Did you include profane language, or did you engage in personal attacks or try to sell something? Were you warned before being blocked? You can see there are plenty of reasons where it's like, no, there's no basis for a complaint. However, there are some instances in which the ACLU says, yes, we would be willing to go to bat for you, and if necessary, to file a lawsuit if your First Amendment rights were being violated. In fact, from their website, they say, so what do you do if you really feel wronged? Well, the first thing you should do is reach out and ask to be unblocked. And if no luck, there's an option to file a lawsuit over it. And there are damages that could be collected if a court rules a government page has violated speech rights by blocking someone or deleting comments. Now, I'm going to offer this suggestion too. You could also just be a decent human being and treat other people the way that you want to be treated. Meaning, don't go at your elected representatives guns blazing, because that's going to put their defenses up in the first place. That doesn't mean you can't make a principled stand and try to influence them and move the needle in the direction that you'd like to move it. But if you keep in mind that people don't like to be treated as if they're somehow presumptive criminals in need of punishment, then maybe you'll get a little bit further. And of course, there are other concerns too. Maybe you're aware of this. This is from Shutdown DC. This is a tweet where they asked DC service industry workers, if you see Kavanaugh, Alito, Thomas, Gorsuch, or Coney Barrett or Roberts, DM us with the details. We'll Venmo you $50 for a confirmed sighting and $200 if they're still there 30 minutes after your message. That's trying to gin up a mob. And I know you may have strong feelings one way or the other about, well, these justices, they deserve it because they didn't decide something the way that I think they should have decided it. But with this kind of mentality taking hold, can you at least understand why maybe some public officials would want to block people who are being particularly abusive or otherwise, coming gunning for them? I mean, look, people who sign up to run for office, I know some people do it because, it's a rush, or it's, they enjoy, exercising power. But if you've never done it, if you've never put your hat in the ring to run for office, maybe you should try it sometime. I'll tell you from experience, putting your name onto an election list and running for election is the surest way to learn what your real insecurities are. Because the moment you sign up, I'm going to run for this office, I promise that your insecurities will come and they will visit you and they will sit on your chest that very night. and keep you company. And it's a very uncomfortable thing. Now, some people get past that very quickly and they just revel in the sense of power, but it's not an easy thing. And I'm not trying to gin up a lot of sympathy for politicians. I'm just saying it's a pretty tough thing if you've not been willing to put your neck out there, knowing full well that people are going to take a swing at you and tell you to your face you're crap and you're expected to just take it. So treat people the way you would want to be treated. I think it's still a really great way to approach things. That whole golden rule, it works just about every time that it's tried. All right, one more thing, just a reminder here. I'd like to invite you to please consider joining us for a little bit of fun tomorrow night. This is at the Log Tavern in Twin Falls, Idaho, 401 4th Avenue West in Twin Falls between 9 and 11. Let Freedom Sing. IFF and IFA are sponsoring karaoke and drinks. You are invited to come and join, and you will see that there are some very talented people out there who love freedom. I'm not one who can carry a tune in a bucket, but if anybody needs some narration, hey, I'm here to help. happy to be your guy. I'm Brian Hyde, and this is Nowhere to Hide.
Are biased, the Idaho Press Club are biased, all media, newspaper, radio.
To be completely blunt here, Brian, and there are plans to expand
indoctrination.
That's right.
Idahoans are also concerned.
Horror shot. That line would be moving a little bit farther west.
I'm like crying.
Nobody wants to see
Dark money is influencing policy in our